March is Colon Cancer Awareness Month, and Dr. Greg Knecht is here from Eugene Gastroenterology Consultants. And thank you for your time, Greg. Appreciate you coming by. I think a lot of people think in terms of colon cancer being a man's disease or a man's cancer, whereas breast cancer is a woman's cancer. But that's not really the case, is it?
Not at all. Not at all. It's pretty equally divided between males and females.
So what is, if colon cancer is number 2 overall, what's number 1?
Well, lung cancer is still the leading cause of cancer death in males and females.
Okay, so colon cancer, Katie Kirk did a whole big thing on this. It is like the most preventable cancer of the whole bunch, isn't that right?
It really is, and a lot of people don't understand the reason for that. Most cancers that are lethal start as a cancer even when they're very, very small and very difficult to detect. But colon cancer is almost the ideal type of cancer to be detected by surveillance because there's at least a 10-year window, a period, where colon polyps, which are benign, start in the colon, and if removed, will no longer be able to go on to colon cancer.
So all polyps are not cancerous?
That's correct.
Oh, I see.
All polyps are not cancerous, but a significant percentage of them are. So the tactic is to remove all polyps that you find. And it takes nearly 10 years for that whole polyp cancer sequence to occur.
Okay, we've got video of a colonoscopy. It's a virtual colonoscopy, but you know, it can remind us as to what it is that the procedure is all about. Now, one of the deals about colon cancer is it's a real family. If it runs in the family, there's a real good chance you're going to get it, right?
Well, I wouldn't say that there's a real good chance you're going to get it, but family history in general increases your overall lifetime risk by about 2-fold, or a little less than 2-fold.
Okay.
But it depends on a lot of specifics, how many people in the family, whether it's a first or second degree relative, and so forth.
And so what are the recommendations? Are they still the same as far as, you know, what we've heard over the years, or do they change like they do with breast cancer?
They're pretty much the same, although they're fine-tuned every year. And the most important thing is for patients, when they see their primary care physician, to mention the fact that they haven't been screened for colon cancer, because sometimes that's lost, although not often. And everyone should really think about colon cancer when they're 50. And they should start some type of screening test at that time.
So it does have to start with the primary the family physician or the primary care physician to get a reference to see you guys?
In most cases, that's how it works, but it's not an absolute requirement. Most insurance companies actually have a benefit for a person to simply call up, say, our office or another office if they want to have a colonoscopy, and they can get through the system that way and be screened.
Oh, okay, okay.
But we recommend that, by and large, they go through the primary care physician just for general purposes and for other screening techniques to be utilized as well.
African Americans are more prone to this than...
They're not particularly more prone, but they do tend to have a younger age of onset. So we recommend for African Americans that the process begin at 40 and not at 50.
Okay. One of the things about cancer, colon cancer, is the symptoms. Like, it's not talked about as much as some of the other cancers. So let's go through the list, because you guys sent me a really you sent me a really good list. So let's take a look at it.
Well, the symptoms I would like to emphasize first.
Can you even see those?
Oh, okay.
Unexplained weight gain. Oh, okay. All right, back here.
Weight loss, yes.
Oh, weight loss.
But the most important thing to know before we get to this list, however, is that there rarely are symptoms at all. And that's the reason screening is so important, is you can't wait for symptoms.
Okay.
So we usually throw out symptoms entirely when it comes to screening for colon cancer, but it is true that if you have unexplained weight loss, that is a symptom of any cancer. Changes in your bowels or bloating, those cramping, pain. The tiredness and weakness symptom is usually due to anemia, because one of the more common findings in colon cancer is that people bleed from the cancer and then they become anemic.
Oh.
Change in the bowel habits, blood in the stool is fairly obvious. Jaundice would be really a very late manifestation and is not really one of the usual symptoms we associate with colon cancer.
I've put together a couple of websites that are pretty good information about colon cancer. So the first one, of course, is your place.
Well, we thank you for that.
And then Mayo Clinic has a really good website, and then WebMD.
Very good websites. All three of those are excellent, and they talk about these issues in detail and are very, very good for the general public.
Thank you so much for coming in. Sure do appreciate it.
You're welcome, Shelley. Glad to.
We'll be right back.